Hi, I'm Dr. Bill Wyatt. I'm a general dentist, but I've done nothing but orthodontics since 1970, and I'm a member of the AOS, or the American Orthodontic Society, and this is a society of dentists, and our sole purpose is teaching orthodontics to general and pediatric dentists. And we have a wonderful organization. We have the, the complete thing. I mean, we've got uh, board certification in the American Orthodontic Society. We have a wonderful journal. We have annual meetings and other meetings from time to time during the year. We have a group of wonderful orthodontic instructors, and we can take you by the hand from the very beginning of putting brackets and bands or whatever and go through the whole thing. If you are interested in learning orthodontics, you can learn it through the American Orthodontic Society. I think that's the best place. I've been in it since it started. I'm board certified in that, and now I'm going to try to go in here and cover some stuff on cysts, what their effect on the teeth and bone, and it will amaze you if you're not used to it. And there's a lot of people don't know a lot of things about cysts, and I don't know all of it. I'm not claiming to do that, but I've learned a lot over the years. Now, is we've got a young lady here that's got a monster cyst on the side of her jaw here, and if you take a panorex of this, you see this cyst that's forming right in this area of the jaw. Now, there's a lot of different ways of dealing with this cyst. An old surgeon dealt with it, and he just took a whole plate off the side of the jaw on the buccal side of it and peeled the thing out and had it completely out, and also eliminated this tooth right here, which really, now that I know more about it myself, was not the best thing to do. You could have left this tooth alone and it would have drifted back over in here and come out. And you didn't need to take that whole side off. You just kept it open up here and kept some iodoform gauze or something. The cyst will heal up from the inside and come out over a period of time. The hole will go away. Now, I've done that. Not too many people have, but I was a missionary in Africa for about 3 years when I was a lot younger. And I had a policeman come into the office one time with a follicular cyst formed from the cuspid. It was impacted down here somewhere, and it couldn't get out. And this gentleman had a cyst as big as a hen egg in the side of his jaw. And I opened this thing up and got I don't know whether I took the cuspid out. I got it out where it was in the open anyway. And I had a whole lot of iodoform gauze that somebody had sent over there for us. And I packed that thing with this gauze and kept it packed for a couple of months at least. And that cyst just healed from the inside out until there was just bone and everything was back in place. The cyst itself doesn't pay much attention to bone. It'll just blow it out all over the place. It can just shove bone all over. One time when I was in Abaddon, the hospital there sent a man in to me. It looked like he had a jawbone as big as my arm down here. It's a huge jawbone. And It had a hole in it down here with some gauze hanging out, and I pulled it out, had a little flashlight, stuck in this hole, and there were teeth roots hanging down in there just like these stalactites or whatever you want to call them in caves. You could just see all back in here. The whole thing was empty. And I was going to get the guy back and pack it, or just keep it open for months, until the thing would shrink up. But this fellow didn't speak any English much, and he didn't know what in the heck I was trying to do. So he never showed up again. So I'm sure this thing just blew out, or else it got a permanent hole down here, and the pressure was off, and it may have shrunk up anyway. I don't know what happened to that gentleman, but that's what cysts can do in there. So let's look at this one. Here's the young lady. This is the jaw where the cyst is. It's down in this area. I think it's over in that part of the mouth. Yeah, here it is. This is where the cyst is, down in this area. So it's a pretty large place. Now the old surgeons are taught to get rid of them, man. They go in and take a plate of bone off and all this. Here's the other side. Now when you look at it, you see this blown out over here on this side. And there it is again. The cyst is in this area, and it shoved this molar up in underneath there. I'm going to show you another one and show you what happens if you don't take it out. This tooth will move right on back up in here. And so the old surgeon had been taught a bunch of stuff, but he didn't really know the best way. In other words, he got to treat it and be through with it. But if you don't do it that way, you just open this thing up and keep it packed, this will heal up from the inside, and the epithelial layer will end up being on the outside here. And then this tooth can migrate around and come up in that area, and I know that would happen if he had done it that way. But then you'd have to see him back every few days or so for several weeks or a month or two for that to happen, and the old surgeons can't do that. But you can as a general dentist or pedodontist, or if you're a dentist and want to work on somebody. Now the orthodontists don't want to do that. They don't want to even deaden the tissue. They don't want to do any surgery on them. But this is a orthodontic problem. It's where orthodontics is just moving teeth in bone, and that's what they should be doing. Really, they ought to be taught this kind of stuff, not just run around here without even injecting anybody to do anything like that. They might have to pay a little higher insurance if they did that, but that's what orthodontists ought to know, how to deal with these complicated, and they're not so complicated if you know what to do about them. Now, here's what the surgeon, there it is again, the same darn thing. Now let's watch him. There's another blown up. Now he aspirated first. He went in, stuck a needle in it, aspirated. He gets this peak bloody fluid in there. That's what they're filled with. Of course, you get a little blood going in there for it. It's filled with that, and it can't get out, so it just keeps growing and pressing out. The liquid won't go through the epithelial layer out, but it can get in there, and so the cyst just continually grows until it can be the whole jaw, as I saw that guy in Africa. Now, not too many people have that opportunity here in the States to see somebody that's totally neglected like that. But I was lucky to see it, even though the guy ran off. And I didn't impress him too much, or I must have scared the heck out of him or something. I don't know what. All right, here is the place. See, the old surgeon will peel this back, and here's the bony covering of that cyst. And he'll take that whole bony cover off and go in and peel this cyst out. You can peel them out, or if you just kept a hold in here and kept the pressure off, it'll reduce from the inside out, and it'll end up with the epithelial over the outside of the tissues. And this patient would have had the bone, and he eliminated this tooth. It looked like it was hopeless to him, but he doesn't know about moving teeth around, and the orthodontist would, or you should, if you look at this and study it. You don't have to extract a tooth. You don't have to cut the big plate of bone off there. You do have to open up a hole, and you can pack iodoform gauze down in the doggone hole, and it'll heal up. All right, here is where the bone was removed. You see, right in here. Took the bone out, and had this molar was crowded down in here, so he took it out to get all the cysts. Afraid he'd leave a little bit. He could have left the whole darn thing and just kept it open, and it would have gone away and come out through the top. And he wouldn't have to take the bone off, wouldn't have to take the tooth out. So these people are trained to do oral surgery, but they don't see patients for 2 or 3 months and come do some little operation and see them back like that. They want to go in, whack the heck out of it, take it out, cover it up, heal it over, sew it back up. It grows back fine, and they're through it. They don't look at it again. But that's not what I want to teach you to do. And the orthodontists are not taught this, and the general dentists are not taught it, and the oral surgeons aren't taught it. So somebody needs to know it. So anyway, that's what really should be done in these cases. Now there's the cyst. He peeled it out, sent it to the lab, did all the proper stuff, and it's epithelial tissue, and go through all this, write it up. That's the way it ought to be done. That's what they think, but that's not the best way to do it. And here the cyst is. It's peeled out. The whole darn cyst would have shrunk up and come out and just been a little layer of outside tissue up at the top if you kept it open for at least a couple of months or something like that. You pack this gauze, just keep it open. If you don't keep it open, it'll close up on you, and it'll still swell up then. Now this is under microscopic things. This is the epithelial tissue, you see, and that's what it looks like under a microscope. All right, I'm going to show you another case, and I knew what to do on this case. I did the work myself. Now here is a young lady, and that's what, by George, as an orthodontist, they do not teach people how to operate on simple things like this, and they should. But you as a general dentist or pedodontist, you darn sure ought to know how to do this and be able to do it, because nobody out there does. The oral surgeon's not going to do it unless somebody teaches him how, but they don't teach them. When I was there, I don't know, they may have smarted up a little bit, but I don't know. I can show you some dumb things that they still do. But anyway, here's a nice looking little girl, got a little problem. I mean, she's got a gummy smile. She's extremely crowded. I mean, just really crowded. And she's got, let me see, I don't think I've got a profile. Yeah, she's not protruding all over the place, but she's extremely crowded and needs some teeth taken out to really make a nice looking case out of this. And these non-extraction guys are nuts, you know. So they are people that need to have their teeth taken out, and we don't take out 1/10 what we used to back in the early 70s, but you do need to take some at sometimes. In this case, really needed teeth removing, remove the bicuspids. Now the upper laterals are erupting in the palate, and the cuspids down on the bottom are pushed out to the outside, and we'll have to look at the x-ray here to really see what's going on in here. And I've got an x-ray about at least 2.5 years before this cyst, before we saw the cyst. Here it is in 1993, and the cyst is formed now, and you don't see much. You hardly see anything at all. It looks perfectly okay. And if you just look at somebody, you ain't gonna know what's going on. So take a Panorex of them, and let's see what's going on. Excuse me. All right. And the upper laterals you're going to see in this picture. Now, I don't know whether we showed back in here. Somebody put a stainless steel crown on this first deciduous molar right here. And they thought they had done a root canal on it. It was infected. They cleaned the pulp out and stuck a little stuff down there and thought it was okay. They put the stainless steel crown, and they didn't see it go bad, but it went bad, and it played havoc with that case. And if nothing had been done, this would have been a basket case. And I'll show you that as we go along. And if you know what to do, it's simple, and you can do it. So that's what I'm hoping to teach people. I've lectured on these things for years, and I haven't touched very many people because they still do stupid ass things like this. And so I've found out here in my old age that you can put it on the internet and it'll go all over the world. And I hope that people will see this, do it. I don't want anything for it. I just want to get it out to people so that people won't suffer from stuff like this. Now, that was the cause of this cyst developing. It's cyst from an abscessed tooth, and the crown over it, and it couldn't drain to the outside apparently. It didn't want to go around the side, so the pressure just went up on it. It apparently didn't get infected because the girl looks perfectly nice, but it formed a granuloma or something that just pushed on those teeth. Same things with cysts. Now you can see the lower cuspids, or lower laterals, I think, sticking out of sides. Cuspids, no, I take it back. All right, here is the culprit. And I've seen quite a few stainless steel crowns that have been put over abscess or teeth that were infected. And they thought they went in there and cleaned out the pulp and they put whatever they want to in there, but it darn sure didn't get rid of it. And then they didn't watch it, and I've seen cysts form from this several times. I mean, a good many times in my life. So if you're a pedodontist or you're a general dentist and you're putting these stainless steel crowns, you better watch yourself if you think you've cleaned the infected part out and packed it with something that's going to kill all the bacteria and everything in there, because later it may flare up later and it'll just push the heck out of things up above. All right, you don't see a lot there. It's kind of swollen out a little bit, but you don't see much. But let's watch what it actually is in here. And here's from the front. You don't see much here either. It looks perfectly. You wouldn't get alarmed at that much at all, you know. Well, this is after we've extracted all this And this is cleared up and the teeth have come in, but I haven't got on the x-rays yet. Now, we took out the bicuspid because it was just too doggone crowded. And that's fine. Now, okay, here is the first Panorex. I took this Panorex in 91, January the 21st of 91. I took this Panorex right here. This looks perfectly normal except it's crowded. I mean, here's these big old laterals, big old centrals, and you're going to stick all this in this little girl's mouth and you're going to push her lips out and she's going to be really protrusive and it just ain't going to look right. So we decided back then that most likely we would have to extract some teeth on her down the line. And she's got all her 12-year molars, and at this point she's 7 and 4 months right now. Now, we didn't see her again, or I didn't take another Panorex. That may have been my fault. I don't know. I usually would get them in, but you need a good reason to take them. Now, I wasn't doing her dental work, but somebody had put this stainless steel crown on that. It looks fine. There's no inflammation at the bottom that I can see, but it's there. And they didn't do a real root canal. You see, this stuff is just kind of in the bottom part of the tooth there. That's not really what it should be. Now, I'm going to not take a Panorex till 93, about 2 years and 7 months or something like that later. So here's the Panorex taken in 93. Now, look at the mess that's created here. Now, you wouldn't see this mess if you just looked at the patient, and you would leave it go for years more. And if nobody saw it, this young lady's mouth would have been a holy mess. I mean, this tooth would have been shoved all up, might have been shoved all up the sinus. The bicuspid would be laying down up here. It would be a holy mess if you hadn't gotten to it. Now, if you know what to do to it now, it's not a big problem. But knowing what to do and doing it, the old surgeons, they would come in and cut all the mess out of there and probably extract some of the teeth and all that kind of mess. They don't know what to do. The orthodontists have no foggy idea because they've never done one of these. Unless they're innovative people that get out of school and get out and start doing some things, but they don't even inject anybody because they don't want to run their insurance up. So they really ought to know what to do. Somebody ought to know. Now here is that deciduous cuspid, you see, that's out over this lateral. This lateral and this one over here are both way lingual. I put little springs on them. We're going to do a first phase orthodontics, kind of push them up there a little bit. Now, so I come in here in 93. I want to go back and forth here. I want you to look, just zero in on this cuspid right here now. And let's see what happens to it. Now, I'm going to go back 2.5 years or 2 years later. Look at that cuspid. Perfectly normal position for the cuspid. And while you're there, look at the bicuspid. It looks normal too. Now, there's no problem. They're just an extremely crowded case. Now let's go forward 2 years and 7 months, something like that. And look what happened. The little tooth is still down there. The crown is gone at this point. But this cuspid has been shoved back here where the roots of it are going up in the sinus. The bicuspid, if left alone like this, is going to be laying down flat, or they could be shoved even further. If this thing grows bigger, this tooth will be shoved. It's already shoved back here. And the roots of this one developed crooked because it's got pressure on it as it formed, so the roots of it are crooked. Now just look at it. Now let's go back where we were and look where it was. I don't mean to bore you to death, but this is something you really ought to know. And I don't think it's taught in the schools, and they won't let the AOS, we're general dentists doing orthodontics, so we can't go and teach the students or show them anything, you know. So they just they think they got the world by the tail over there. See, I have known some excellent orthodontists, real good people. Many of them have helped me a lot. Dr. Larry White, who set the school up in San Antonio, was a real good friend, helped me tremendously. And Dr. Trevino in Monterrey, Mexico, excellent orthodontist. Dr. Mitchell, head of the department at Emory, taught with me. He got away from Atlanta and taught with me, but boy, they gave him a hard time. Dr. Moyers, Dr. Miro was the head of the department in West Virginia, and a lot of excellent orthodontists, but a lot of them just, boy, you're getting that, they think you're going to take all their work away. But if you taught general dentists what to do, there'd be more orthodontics out there than they could shake a stick at. There's just lots of it going on that need orthodontics here. All right, see where those crowns are now. See what happened to them in 2.5 years with just a little cystic pressure on there. Now we're going in here. We need to extract teeth badly on this case. So we take these baby teeth out, we take this permanent tooth out, we take this baby tooth out, we take the permanent tooth out. Well, that's the cuspid. Let me see, we took the bicuspid right here. I'm sorry, not that one. Here, we marked the panrex. It's real good to take your panrex, mark your game plan out on this panrex. Then you have to just flip it up in front of you and you'll know what you're planning to do. If you've got very much of an orthodontic practice and you're seeing a good many people, you just can't remember all the mess that it's good to draw it out and you can see it at a glance. You don't have to read 3 pages of stuff to find out what you're planning to do, and you can just see it so much quicker in there. So we take those teeth out. And now watch what happens. That was 93. And here it is in 94. January of 94. And this was 8/30. So it's nearly 9 of 93. So you got 9, 10, 11, 12. And January the 25th. So that's about 4 or 5 months, 5 months have gone by. Well, no, it's January the 25th. Yeah, that's about 5 months gone by. And look what's happened. All you did is just eliminate and figure out what needs to be done. You kept the thing open. This tooth comes down. This tooth comes out. We've taken this one out of the way. We took the baby teeth out. We cleaned it's open, and keep it open if you can right there. It doesn't matter. This will come on in and open it up. This side is clearing up too. These laterals that were lingually located, now I plan to put some kind of little arch in here to kind of a early phase of the orthodontics and treat that for a while. And let's see what happens. I'm not going to show you this case end up. I don't know. I'll show it just through the finish of the first phase. Now, we put something on here and it's going to bring this root over. But you see this root was formed crooked because of that cyst pushing it up in this area. a lot of dentists don't sit down and take these panoramics and look at what caused it to happen, what made it happen, and figure that out. Then you'll know kind of what to do to the case. All right? Put a little deal on there, just a little simple, nothing orthodontic thing, and darn things almost straightened itself up. You see that crooked root came out like this. Keep the crown looking good regardless of where you have to put the root up here. See, it's headed up in here. Now, if you try to rotate a tooth with a crooked root like this, it's not going to be too easy. It has to go a long way. Now, here I'm going to show some blown up pictures. There's where it was. There's where it came in 5 months. And then all you had to do is just guide it down into place. Put a little bracket on it. Put one of these simple little flexible wires and line it up. And it's nothing really. And you've changed the whole life of this child. That young lady, if gone untreated, which are going untreated all over the world, and in many places here in the United States, you see. That's because somebody doesn't know what they're doing. If you know what you're doing, it becomes simple to you. And I hope you take these darn videos and go over them, and some way or another we got this stuff where we can spread it all over the world. And I just thank God that this came along before I left, before I'm leaving. And this, if you look at this panoramic, take this darn tooth out and let that one swing down in here before. It's got plenty of room. Here's the second molars coming in. I don't know whether she'll form wisdom teeth, but I don't think she will. This is 10/3 of 95, and I don't know how old she is right here. But anyway, the rest of this is coming in. It's just simple. Won't be anything to it. A lot of people come in here and try to take these orthodontic courses thinking everything in here is going to be simple as that. But it ain't simple, and you got to study it, and you got to learn some stuff. Now, when I tried to learn it, I've been kicked out of places where I was trying to learn something. You can learn it now. Now, I probably should have gone in and done something. This is not finished. This is just the first phase, you see. But going in the second phase is nothing. You pull that in place and line this one up over here. And I think that may be the end of what I've got on this. And there's the models, and here it is, how it's treated, and that's nothing. And the orthodontics doing this is nothing. It's learning what the heck to do with situations like that. Now you can learn to stick brackets on teeth. It's so stupid for people to say, well, you're a general dentist, you don't know how to put a bracket or a band on a tooth and stick a stupid wire on there and move a tooth around. You don't know how to do that. But you can do a complicated pin lock bridge or some difficult things. That's so dumb. You can do this too. You just need to learn it, be taught it, or get after it yourself. Now, I have no place for somebody that's wanting to jump in here and do a bunch of crappy orthodontics and make a lot of money out of it. That's what they think they're going to do. I don't give a darn about you. But I am concerned with honest, straightforward people. And that's the end of this deal on cysts. That's not very much, but there's a lot to know in that. And so I hope you will learn it. I'm going to stop this.